I'm Kim Clift. I'm the CEO at Tri-State Health.
My name is Carson Sieber. I'm a family physician at Tri-State Health.
Tri-State Health is on a journey to establish a family medicine residency program here in the Clarkston-Lewiston Valley.
My name is Jolene Carper. I'm the Chief Operating Officer for Tri-State Health. A family medicine residency is not just important to Tri-State, it's important to the Lewis-Clark Valley in total. Here at Tri-State Health alone, we get between 300, 400 requests every single month for primary care or family medicine physicians.
Tri-State feels it's our responsibility and our obligation to help ensure that there are healthcare providers to care for this community, both currently and in the future as well. Within the Lewiston-Clarkston Valley, as well as nationally, there is a significant and growing healthcare professional shortage. In fact, Asotin County is a health professional shortage area designated by the federal government.
What our statistics show is somewhere between 16 to 19% of the patients that seek care, maybe in our walk-in urgent care center or our emergency department, don't have a primary care or a family medicine provider or physician. And so I oftentimes think, what happens to that patient once they leave the emergency department and they have a need for additional services? Who guides them?
We need more family physicians in rural and underserved areas. It's estimated that we'll need another 180,000 family medicine physicians over the next 10 years. The only way to do that is to have sufficient family medicine residency programs. Basically, the way I look at it is if we don't do that or help contribute to that need, then who else will? We are in a position with the size of our healthcare system here to do such a thing, and we are in a rural and underserved area with a higher likelihood that trained resident physicians would come and stay and practice locally.
Oftentimes, an individual will stay within 100 miles of the location with which they conduct their residency experience. One of Tri-State's primary partnership for a residency program will be Washington State University's Elson Floyd College of Medicine, and they will be our sponsoring institution. And so they will help make sure that we are delivering that high quality clinical and educational experience for our residents.
So family medicine residency brings medical students into the community, partners them with faculty that then teaches them in various areas, whether it be primary care, emergency medicine, cardiology, gives them an exposure to many, many specialties as it creates these well-rounded family medicine physicians out into the future.
Tri-State Health has had substantial growth in the last decade. We are a critical access hospital, and as far as critical access hospitals go, we are bigger than most. We are better prepared than ever to host and accommodate a family medicine residency curriculum.
We are going to be able to offer an experience in a rural setting that maybe others can't. And that is because we have a breadth of specialty care providers that you don't typically see in a rural community.
I would say what we have heard is startup costs for a family medicine residency is somewhere in the $3 to $5 million range.
And it's not an insignificant number, but the benefits far outweigh the costs of this program. The benefits to the community, both from primary care through those 9 residents that we will have on site, as well as the benefit for those residents that choose to stay in practice here in the LC Valley, whether that's with Tri-State or somebody else or independent.
We can't do this without community involvement. There's lots of state and federal funding opportunities, but we need our community to support this. I think the biggest thing the community can do is what they've done all along. We have a very giving community. They've been very good to Tri-State over the years.
There'll be lots of information continuing to come out in the future, and we will most certainly help you participate in this new and exciting endeavor as we move it forward.
Tri-State is a community-owned hospital, and so every dollar that we generate, every dollar that you contribute goes right back into the organization with the intent of serving and supporting the healthcare needs of the community. And this is no different. So each and every way that you contribute to this program, whether it's financially or otherwise, you will see the benefit. The community receives the benefit and will continue to receive the benefit of that in dividends for years to come.